I'm quite certain that everyone is in a position right now where you're really excited and you know that there are new things coming ahead, and we'll be introducing the new topics for the universal treatment curricula for the intermediate level. Many of you sitting in this room have gone through the basic levels, many of the 10-volume, 10-manual set. Those of you sitting here have gone through the training. Many of you have been doing the trainings. Many of you have been engaged in the writing, rewriting, reviews of those, the critiquing of those. So I know you're excited to know that we're moving to a new level. We have done as much as we can for basic learners, and guess what? We're moving now to the intermediate level. And we know that those of you who have said, oh, I know this stuff. I've been through all of this. When are you going to give me something new? Well, guess what? It's coming your way. So by the end of this year, ISSUP will be rolling out its universal intermediate treatment curricula. And those titles for the curricula are Pharmacology and Substance Use Disorder, which is a 5-day training, Managing Medicated Assistant Treatment Programs, for those of you who will be or interested, may be physicians, nurses, pharmacists working with or intending to work with medicated assistance programs. This program is for you. Enhancing motivational interviewing skills. Yes, we've all gone through motivational interviewing training. Yes, we all think we're experts in MI. Yes, we all know the stages of change. Yes, we all know so much about MI, but guess what? There's still more to learn. So in the intermediate level, you'll be learning more skills and developing more comprehension understanding of MI. You'll also be looking at CBT, cognitive behavioral therapy, which we've talked about a great deal today by the other presenters, and also contingency management, which was also alluded to earlier, working with families for those of you who are skilled enough to understand that families need to be engaged in treatment. And when I say skilled enough, that's a comprehension, not necessarily having the skill. But in reality, it does take a special skill to work with families. And I understand that that training is going to be held here this week. So I know you're excited to already be having that part of the intermediate manual introduced to you, modules rather introduced to you. We'll also be looking at screening for co-occurring disorders at a higher level, and then skills in counseling and theories, and also case management, crisis management at a higher level, looking really at the issues that your clients may be experiencing and exposed to, and then clinical supervision, which is a brand new topic as well. So I'm just going to run through some of the thoughts, ideations that will go into the manuals themselves. For pharmacology, we're looking at the pharmacodynamics and the nervous system. We're also looking at ways that dopamine with the addicted clients and populations we can assess better, and the endorphins, GABA, and its calming effects, and even the progression of muscle relaxation. There's some things that are similar to the basic, enhanced in the intermediate, as you will see as you go through the training, but also some new skills and topics that are added in. In managing medicated assistant treatment programs, this manual in particular, as I said before, is geared towards persons who will be working in medicated assistant services or setting up medicated assistant services. I'm not going to run too deeply into that because it will be by invitation, I believe, so that you can look forward, if you're interested, to get in touch with ICE to see if you will qualify to be a part of that program. The MI skills we pretty well know, so I'm not going to run through all of those either, but understand that even as we're talking about the recognition of key concepts and aspects of client speech that will guide the practice of MI, the intent for you within this manual, this module, is to have more practice, for you to be able to demonstrate within the 3 days of this training that what you learned in the basic, you're now able to enhance even the more in the intermediate model. So you will be preparing yourselves not just to work directly with your clients, but because MI is also an intricate part of clinical supervision, you will learn how to use MI in the clinical supervision modules as well. The CBT itself, cognitive behavioral therapy, though it is a clinical skill, it is separated out on its own this time because of the impact that cognitive behavioral therapy has on every aspect of a person or persons entering care. Addictions treatment has been shown to improve, enhance, the clients benefit more when they're engaged in CBT. And so ICE has determined to have this as a separate skill, a separate course unto itself. So those of you who are really interested in becoming better prepared and working with cognitive behavioral therapy in the community-based treatment centers in residential care with adolescents as well, please be sure to look out for this course in the future. The cognitive contingency management reinforcement care, new topic also, separated out from the skills, counseling skills level, the reason being the same as with the CBT, in that the skills and knowledge and competency in contingency management needs to be focused on by itself, unto itself, in order for you to be able to better plan with your clients, for you to be able to look at treatment assessments and needs in a more constructive and conducive way to help them comprehend more their future needs, their recovery issues. Screening and co-occurring disorders. As you all know, the DSM-5 in 2013 became an integral part of our practice. And so in this manual in particular, though introduced to the DSM-5 in the basic, you'll be more intricately involved in the use of the DSM-5. You will also have the opportunity to explore and examine health issues with mental disorders and substance use disorders through the use of this manual. We've talked about the skills of clinical use and practice, combining this, though, with a separate 2-day course on case management specific to the understanding of your job as a case manager. Case management and clinical counseling have been so enmeshed, involved. I call it potatoes and gravy. You know, you have your potatoes on your plate and you throw the gravy on top. Well, the clinical skills is the potatoes and the case management is the gravy. And everybody just throws it all together and they forget that they're two separate skills. So we would like to separate them out for you and help you to understand that case management is a special skill and that clients really do have a need to have a case manager simply looking at their medical issues, their clinical issues, following them through the regimen of care, as they too understand what their clinical skills and needs are. So we would like to have you take the opportunity of the 5 days, clinical skills for 3, the case management for 2. And this is a part 2 for case management. We'll be looking at crisis management at a different and a higher level as well. Many of you understand the ideation of suicide. Many of you understand how impromptu homicidal ideations can be as well. But we'd like for you to practice during this manual to examine how it is that you can better assist, facilitate with a client in order that their thought process, their issues are resolved so that they do not return to those thoughts. And also so that you can be certain that for the families dealing with the suicidal ideations, with the community having to face that you're giving them all the opportunity for better facilitation of care. Clinical supervision, new skill, new opportunity for you to become clinical supervisors. ICE does have its own clinical supervision credential. We'll be offering that and have been prepared to for the last few months. So going through this training will aid you to be prepared not only to become a clinical supervisor, but also to become certified as a clinical supervisor. I've not gone through how to develop, because most of you have already had a basic level training through the UTCs. So I honestly didn't think that I needed to talk with you about how it is we chose topics, how it is that we determined what information needed to go into the manuals, because you've already been trained on the foundation of the UTCs. What we wanted to do was to give you some information. We're hoping that it will incite you not to riot, but to go out and be prepared by the end of this year to sign up for these courses, also to incite you to look towards a future of higher learning and growth. For in this profession, as I was taught 40 plus years ago when I became a counselor in addictions, that once you think you know everything, once you believe that you've learned everything, you're no good to anybody. So I'm hoping that you will look at the fact that you can be the best that you can to everybody and in everything that you can do. The more you learn, the more you grow, the more your clients grow, the more our profession grows, the better we all are. Thank you.